Welcome everyone to our weekly Q&A with Toronto's Associate Medical Officer of Health, Dr. Vinita Dubey. Thank you so much for joining us today, Doctor.
Of course, thanks for having me.
We apologize for the slight delay. I know everybody's been waiting, so we're going to get started right away. My name is Dilshad Burman. I'm a writer and reporter with City News and City News 680, and I'll be moderating this chat today. The way it goes is we've been collecting your questions over the past week, and we will present them to the doctor today. She's never seen them before. It's all off the cuff. And if you haven't had a chance to submit your questions yet, you can still do so in the live chat during this broadcast, and we'll try to get to as many questions as we can. Now, this week is a little different from normal weeks. We've got a theme this week, and it is COVID-19 and pregnancy. So we're going to prioritize those questions first. And of course, we'll get to all of the other COVID-19 related questions right after that. But for now, we're going to start with our pregnancy questions. Doctor, are you ready to go?
Yeah, let's go.
Wonderful. So let's get started. We've got a few that we've sort of aggregated over the past few weeks regarding pregnancy, and also a few that came in when we put our social call out. So let's start with Julie from Twitter. Julie asks, will pregnant women be in the first waves of people able to get a booster? I'd really like to get one in my third trimester.
Okay, so I think right now we have had booster recommendations come out, and the National Advisory Committee on Immunization continues to look at who will be recommended to get boosters. So we'll have to wait and see. I think the one point to know, like Pfizer was just licensed in Canada by Health Canada for booster doses, and it was licensed to give a booster dose 6 months or more after your second dose. So most people who got their vaccine earlier than that might have been, say, a healthcare worker who are now eligible, for example. But most of us, actually, if we got a dose and we weren't part of any specific category, it has not been 6 months yet since our second dose as well.
Right. And then let's move on to Kathy's question. Kathy says some family doctors are advising not to get vaccinated during pregnancy. Others are advising that it is safe. Why is there conflicting advice with vaccines and early pregnancy?
Yeah, that's unfortunate, and I really am sorry for that conflicting advice. There's no question that right now, where we stand today, based on a lot of information, the recommendation is to get pregnant, well, if you are pregnant, to get the vaccine at any stage in their pregnancy, preferably right away, like get vaccinated as soon as possible, because in pregnancy, your risks of the COVID infection are much higher, and you don't want to wait because you could get a severe COVID illness.
Right. And then MM says they are pregnant and work in a healthcare setting. My OB has suggested I take both the flu shot and my third booster shot as long as they're at least 2 weeks apart. I work in a healthcare setting, booked my booster Pfizer for next week, and my second shot was back in February. Can I get a second opinion, and are there any concerns about the third dose in pregnancy, as I will possibly be one of the first pregnant people to get a booster?
Yeah, it's a really good question. I mean, I think what I can say is we in general have data to show that the vaccine is safe in pregnancy. I don't think that there's any particular data to support or to refute, why the third dose would be more serious or harmful, even in pregnancy. So I think that that's good news. Like we know that if you get it for your first or your second dose in pregnancy, in general, the third doses have proven to be safe and effective in general. Now, you're right. We don't have a study that has shown booster doses in pregnancy and their outcomes, but we at least have that for non-pregnancy, and we know that when you're pregnant and you get your first or your second dose, that's safe. Now, I think ultimately the third doses really are about your individual level protection, and so I would definitely encourage you to have that conversation with your doctor. Healthcare workers are being provided those third booster doses. Part of it is because they got their first dose so far ago. And as well, many healthcare workers got a short interval between the first and second dose. And we know that short interval, like 1 month or less, gives you the less strong immune response to that second dose.
Right. Okay, let's move on to another question because you were talking about any stage in pregnancy, doctor. So Jess says, I'm 7 months pregnant and on bed rest because my pregnancy is considered high risk. Is it safer for me to wait till my child is born before taking the vaccine?
There's no reason to wait. And no, I don't think it's safer for you to wait, actually. I think it's actually safer for you to get the vaccine now, because should you get vaccinated, should you get COVID, it can be more severe. And you may think, well, I'm on bed rest. How will I be exposed? I mean, presumably because you're on bed rest, people will come and care for you. And so there is always that risk.
Yeah.
We also know that if you get the vaccine in pregnancy, your body will produce antibodies, and those antibodies will pass through the placenta and will help to protect the baby. So even after the baby is born, they will have some of those antibodies. And so that's another reason to consider the vaccine while pregnant as well.
Okay. And then Melissa asks, how come the vaccine has not been fully approved for 5 to 11-year-olds yet, but we're saying that it's safe for a developing fetus inside a pregnant person?
Yeah, so I mean, two different things. I think we certainly have enough data now that many hundreds of thousands of pregnant women have been vaccinated. They've been followed, and the vaccine has shown to be safe in pregnancy. But it's also balanced with the higher risks, right, in pregnancy. So, a pregnant person, same age, by comparison, just being pregnant has a much higher risk of getting severely sick from COVID. And that is the reason for vaccinating. The studies, though, and the follow-up of people who have been pregnant have not shown any harmful effects to the baby that has been delivered in vaccinated compared to unvaccinated people.
Okay. And then we're going to move on to some questions that we've just sort of been collecting over the entire time that we've been doing these AMAs. So let's go with this one. If you got both your vaccine shots before you got pregnant and have now become pregnant, do you need a booster shot during pregnancy? Why or why not?
So right now, there is no recommendation that with, every pregnancy to get a booster dose, for example. So we'll have to wait and see if that's something that comes. That's certainly not something that has been recommended. No. So it's really, the recommendation really is get vaccinated as soon as possible. Don't wait to get pregnant to get your vaccine. I mean, get your vaccine even before you get pregnant. Right. If you didn't get vaccinated before you got pregnant, then get vaccinated while you are pregnant as well.
Right. But currently pregnancy is not one of the conditions under which you would get a booster.
That's right. That's the current recommendation. It's not one of those conditions. Yeah.
Okay. And then the next one, how many pregnant women who get COVID are ending up in hospital? Is there sort of a percentage or ratio or any stats that are available?
Yes, there are actually. There's a lot of very good information. Born is this registry that actually has a really great website that compares some of the information for Ontario. So I would encourage viewers that are interested in the stats to look up that website. But in general, for example, one of the stats that I've seen is, that the risk is, for example, 10% of people who are pregnant ending up seriously ill in hospital compared to their peers who may be the same age, 3%. So it is that much more of an increased risk.
Right, that's a significant difference between those percentages. And doctor, you said born, so it's just BORN.ca?
Yes, it's an acronym. It stands for something which I won't try to remember. Okay. Yes, that's so. I know. So just Google born pregnancy registry, and you'll get that.
Okay, perfect. Okay. And then we've touched upon this, but let's do it again. Does the COVID vaccine pose any danger to the unborn fetus?
There is no evidence that it poses any danger. In fact, the COVID vaccine is not the only vaccine that we recommend in pregnancy. We have certainly recommended the flu vaccine in pregnancy, even the whooping cough vaccine in pregnancy, because we know that by vaccinating the pregnant person, the antibodies can actually pass to the growing baby. And so then the baby is born with some antibodies, some level of protection when they need it, because they're so vulnerable in those first few weeks.
Right, makes sense. Okay, let's go to YouTube. We've got a couple of live questions coming in. They're not pregnancy related, but we're going to take them. Let's start with this person's alias is the Shoeless Guy. The Shoeless Guy asks, there was recently a paper published in the Lancet covering vaccine immunity waning after 3 months. What are your thoughts on that?
So I think there are a number of studies looking at waning. I think you have to look at waning from a number of different lenses. And a lot of the papers that have been studied have looked at antibody response, for example, immune response. But we know actually that if you test antibodies, sometimes they're very low after vaccination. It does not always mean that you are going to get sick. They're low until your body is exposed to the virus, and then it develops an immune response without you getting sick. So I think that's one point to say, is you can't just rely on papers that look just at an immune response like antibodies or T cells or whatever it is. I think the other point that I would make is, in Canada, most people, and Ontario as well, have had that longer interval between the first and second dose. And we know that that is playing an important role in terms of giving that stronger response to the second dose. It also means that most people, it has not even been 6 months since they've had their second dose. And so there may not be signs on a very large level in Ontario for that waning, even just because of that.
Okay. And then another question on YouTube here from Red Reaver. Do we know if booster shots, so the third shot, prevents the infection and transmission of COVID-19?
Yes, that is one of the reasons for getting the third dose. Now, right now, who is recommended to get it, for example, if you're 70 years of age or older, we know that there is evidence for waning. We've actually seen that in the numbers, that some of the people who are vaccinated and getting hospital are some of our seniors, even though they're vaccinated. And so giving that third dose will boost their immune response to keep them from getting very sick. Again, that is our goal, but also to keep them from getting COVID, which will prevent transmission as well.
Right. And doctor, we get this question a lot regarding infection and transmission when it comes to the COVID vaccine. But even when it comes to other vaccines like the flu vaccine, nothing is 100%, correct? The idea is just to not get so sick that you land up in hospital or, God forbid, die.
Yeah, the main goal for vaccines is really to prevent that severe illness. Now, sometimes it is to prevent transmission. Like when we look at polio virus vaccine, we're giving it because we don't want to get, polio has a very high asymptomatic transmission rate. And so we want to prevent transmission because we don't want to see polio come back. So it really does depend on the disease and the vaccine that we have that's available.
Right. Okay, let's jump back into our pregnancy-related questions. This is a good one. Are the side effects from the vaccine worse if you're pregnant?
I have not seen evidence for that, no. And I think, what we talk about, one of the reasons why an infection can be worse in pregnancy is because your body has a slightly weaker immune response because you're pregnant. And so, that means that you may respond to things differently being pregnant. But I don't think it necessarily means that you'll have a worse side effect.
Okay. And then have there been any documented cases of birth defects after the pregnant person has taken the vaccine?
Okay, so another good question. So I think when we answer this question, I think we have to recognize that, about 3% of all births that occur may have something that has happened, like a preterm birth or a congenital abnormality. And so really what you have to compare is vaccinated groups compared to unvaccinated groups. And what you find is that in the vaccinated groups, there are no more higher rates of some of these outcomes or results that you may expect to occur naturally. It's not higher in the vaccinated groups.
Okay. And then is the likelihood of having a premature birth higher if you take the vaccine?
No, it's actually the reverse. So actually, if you get COVID and you're pregnant, you have a higher rate of a preterm birth. That is actually one of the reasons to get vaccinated.
Okay, okay. And then has there been any further study on fertility issues related to the COVID-19 vaccine?
Yes, so there's ongoing look at this. I think it's important to know that there have been no scientific studies that have linked the vaccine to infertility, none, okay? But this continues to be looked at, to be studied, to be monitored, and there continues to be no ongoing link between the vaccines and infertility.
Okay. And then let's go to this next question. Pregnant women are told to stay away from most medications, even simple things like Tylenol. How is the vaccine safe during pregnancy if most other medications are not?
So actually in pregnancy, you can actually very safely take some medications like acetaminophen. Actually, as a physician, I have certainly advised some of my patients on that. There are some medications that you are not recommended to take that would not be safe, but it's not the case that all medications are not recommended. So I think when we think about giving the vaccine in pregnancy, it's all about balancing benefits and risks. And the risks, if you get COVID and you're pregnant, are very, very high, very, very serious. And that's why, you know, and the vaccine is showing to be safe in pregnancy. That's why the vaccine is recommended in pregnancy.
Right. And doctor, just to clarify, in terms of pregnancy, is that sort of being pregnant, is that a condition that then makes you more susceptible to the virus now? Have we determined that?
I don't think it's the case that, you know, you're more likely to get COVID. You know, getting COVID is really going to be based on, you know, are you wearing a mask? Do you keep a physical distance? Have you gone to a crowded environment full of unvaccinated people? Like, that's going to determine your risk for getting COVID. We do know that in general, unvaccinated people have a higher risk of getting COVID than vaccinated. But if you get COVID and you're pregnant, you are definitely more likely to get very sick from that COVID infection.
Okay, okay. And then let's move on to this one. Has there been a noted rise in miscarriages following vaccination against COVID-19 compared to maybe last year when we didn't have a vaccine? Some are saying there are 80% more miscarriages this year.
I have not seen that statistic, no. I think that the studies that have been done, I mean, there have been some that have been published by the CDC, for example, that have compared the rates between vaccinated and unvaccinated, or vaccinated and what we know the general rate to be, and it is not higher.
Okay. Somebody on YouTube actually does say, from Razia, they say this is not the only vaccine that is offered during pregnancy. There are, as you mentioned, doctor, there are other vaccines that are offered during pregnancy.
And I think if someone is concerned about, you know, miscarriages with vaccination, I mean, get vaccinated before you get pregnant. I mean, that certainly is another option for those who are worried about that.
Right, right. And then here we go. If I do get the COVID-19 vaccine while pregnant, does the baby also develop antibodies against COVID? I feel like we just touched upon this.
Well, it's not that the baby develops antibodies. It's actually that you who are vaccinated, you develop antibodies and you transfer those antibodies to the baby. So that's how the baby gets antibodies.
Okay, okay. And then, okay, let's take this one from YouTube. I'm not sure if it's pregnancy, a little bit pregnancy related. Okay, Julia asks, are there any studies yet on why females got their periods disappeared or hair loss increased after the vaccine? How do you recommend to plan your pregnancy if the vaccine affects your periods? And does the vaccine affect ovulation and your period cycle?
Okay, so good question. So I think there's two ways that I answer this question. One is that menstrual irregularities, so having either a heavier period or a missed period or a longer period, those can occur in women. Stressful situations can bring it on, too much exercise, like there are a lot of things that can actually disturb our menstrual cycle. And some people have found that after vaccination, maybe they have a heavier period. So it could be unrelated to the vaccine, just associated in time. There is some postulation that maybe it is related to the immune response to the vaccine that may be contributing to maybe a heavier cycle, for example. Again, even if it occurs following the vaccine, it is short-lived. It is not ongoing. It is temporary while your body's developing the immune response. Maybe it is like a stress response or an immune building response, for example, contributing, but then not associated with long-term menstrual irregularities because of the vaccine.
Okay. And then I'm just coming to our last pregnancy-related question here. Is there a preferred window during pregnancy in which you should get the vaccine? Is 7 to 8 months too late to get it?
It's not too late, no. And we know that the later you are on in pregnancy, and if you get COVID, it can be serious. Still safe then, still the chance that you could pass the antibodies to the baby. And, you know, again, we talked about you more likely to have a preterm delivery if you get COVID in pregnancy. So that's another good reason to get vaccinated, even at 7 months.
Right, okay. And then we have about 6 minutes left. So we're gonna go into some non-pregnancy related questions here that we got over the week. Let's start with Paul. Paul asks, I booked my appointment last week for my booster shot, and I got my last shot in June. Both my shots were AstraZeneca. When I arrived with all the proper documentation, including the text message, I was told I was ineligible to get the booster. I do qualify under the rules presented, yet I was turned away. So is there a problem with the booking system? Has it not gone into effect yet?
So you have to be 6 months from your second dose of the AstraZeneca vaccine to be eligible.
Okay, that's what it is. So it was June. So that's not 6 months yet. That makes sense. Okay.
Exactly. Yeah, and you cannot book it until you are eligible. I've heard that with the booking system. Yeah.
Okay, makes sense. Okay. Wings asks. Wings is our regular contributor. Wing says, I am getting ready for my booster shot of mRNA since I was fully vaccinated with AstraZeneca 168 days ago. Are the side effects mild or severe since this is a different type of vaccine? And I've also received the flu shot.
Okay, good for you, Wings, for being eligible and getting your mRNA vaccine. There is no indication that third dose following the AstraZeneca will be more severe when it's 6 months later. Now, there were some studies that showed if you got AstraZeneca and then messenger RNA for your second dose, you might have slightly more symptoms following the messenger RNA. But that was with a shorter interval. So with this longer interval of 6 months, I wouldn't expect that you would have that you could guarantee that you would be very sick. Again, we can't always predict that, right? In terms of who is going to feel very unwell, have a headache. But what I can tell you is if you have symptoms, they are still, again, likely to be 1 to 3 days and to recover thereafter.
Right, okay. Let's move on to Kathy D's question. This is, again, the same as the menstrual cycle question you just addressed, doctor, but basically, why is the COVID-19 vaccine affecting women's menstrual cycles, like more cramping, heavier flow, longer, shorter cycles? It seems like a lot of people are saying this.
Yeah, so I think some of it some of it may just occur. Again, some of those menstrual irregularities can be common and can be caused by many other things as well, but could also maybe be part of building an immune response to the vaccine. And as we know, like, you know, when you're not feeling well a few days after the vaccine, some people take it as a badge to say, well, yes, that means my immune response is working. I mean, if you don't have symptoms, it does not mean that you don't, that's not the case. But that may be something else to take some comfort in.
Right. And then Elsie asks, are booster shots going to be available for those who received both doses of the vaccine in January? Many seniors received the vaccine as they were many seniors received the vaccine as they were designated as essential.
Yes, so seniors are eligible right now. So 70 years of age and older, if it's been more than 6 months since your second dose, yes, you are eligible. If you were a worker working in a senior care center and got your vaccine more than 6 months ago, or are an essential caregiver, again, you would be eligible to get a booster dose now.
Okay, okay. And then Carl asks, my daughter turns 12 next year and is tall for her age. Should I wait until January to give her the adult vaccine or get the first one as a 12-year-old child right away? My fear is that the dose for children is not enough for her anymore and she won't get the coverage that she should.
Yeah, this is a really good question and one we're getting a lot from parents. I mean, we'll wait to see what the National Advisory Committee on Immunization recommends on this. My recommendation, though, is to get the vaccine based on your age. It's not really based on the weight or the size or the height of the 11-year-old. It's more based on their developing immune system. And at 11, the immune system is often stronger, develops an immune response quickly with less. And so right now, that is the guidance that I am providing. That to plan to get the first vaccine that you're eligible for based on your age.
Right. That's very interesting, doctor. You said that it doesn't depend on size because a lot of medications depend on sort of size, weight, your body composition, that kind of thing. But that's interesting that you said it depends on where your immune system is in its development.
It also depends on the vaccine. So for example, the flu vaccine that we're giving right now, it is the same dose that we're giving to 6-month-olds and to adults 64 years of age. But 65 plus are getting 4 times the dose. So some of it depends on the vaccine as well.
Oh, very interesting. Okay, that's a good point to note. And we have 1 minute left, so I'm going to jump into a live question that I saw on YouTube, but I feel like it's disappeared, but good to address anyway. What is in the third booster shot?
So the third dose of the Pfizer vaccine is the same Pfizer vaccine that people would have got for the first and second dose. The third dose that's being recommended for Moderna, if you're 70 years of age and older, it's 100 micrograms. So it's the same dose as what was given for first and second doses. If you are less than 70, it is 50 micrograms. So it is the half dose, but it's the same formulation. It's not a different vaccine.
And that's if you've gotten either shot. Say I got 2 Pfizers and I'm getting a Moderna booster, it's still going to be that lesser amount.
Based on your age, yep, or exactly, yep.
Okay, and that brings us to 1 o'clock. Lots of questions today. Thank you so much, doctor, for taking the time and having the patience to answer all of these for us today.
My pleasure. Have a good week, everyone.
Absolutely. And thank you, everybody, for participating today. We'll be back with the doctor next week with another theme. And for now, we'll say goodbye and good luck. Thanks, doctor.
Bye.